This question is discussing pulses. It's stating which of the following is not a method for obtaining a patient's pulse. So we're looking for which choice is incorrect. Option A states radial artery at the wrist. And this is actually one of the most common ways you will see for obtaining the pulse. It is fairly easy to do. You might even have done it on yourself. And the radial artery is found at the wrist. So we could eliminate that because the question, again, is asking which is not correct. Option B states apical pulse using a stethoscope at the fifth intercostal space, midclavicular line. And yes, that's correct. The intercostal spaces, those are the spaces that you feel between each rib. So it's talking about the fifth space at the midclavicular line. So that means that your clavicle is where your midclavicular line is. So it's in the middle area, and then you have each of your ribs. So it's talking about the fifth space of the intercostal spaces, the midclavicular line, and this is where you would put your stethoscope to listen for an apical pulse, and that is a method that you could use to obtain a patient's pulse. Again, the question is asking which is not a method to use, so we can eliminate that. Option C states carotid artery at the neck. This is not one that's routinely used for patients, but it will be used in an emergency setting. If you've done your CPR training, you might remember that you feel for your pulse at the carotid artery of the patient to feel for if there's a pulse. And you'll also be assessing for breathing during that time. But that is used in an emergency setting. And again, the question is asking which is not a correct method, and it is one, so we can eliminate option C. And then that leaves us with option D, popliteal artery behind the knee. So that is a actual artery that exists in your body. There is a pulse behind your knee, but it's a little awkward to get to on the patient, and it could be difficult to feel for as well, which means it might not be as accurate also. So this is not a method that we usually would use to assess a patient's pulse, unlike all of these options over here, which are ones that we would use. But since the question is asking which is not a correct method, that means that this is your correct option, option D, which is the popliteal artery behind the knee.